Okay, so to look at tightness or weakness within the hip flexors. Quite often we kind of assume that when we're getting pain in the front it's because of tightness, whereas actually sometimes it could be a weakness. So one good way of assessing that, if you've got tightness in your hip flexor, is finding a nice surface. I mean, obviously I've got a massage couch here, but you might find that you've got a stable coffee table or a ottoman or something like that to lean on, or a sofa that's relatively stable. Beds sometimes have got a little bit too much give in them, but if you've got a decent bed that's got a fairly solid mattress, or a fairly hard, firm mattress, then you may find that you can use that and that's acceptable. Obviously, in clinic, we do this assessment sometimes with patients that are presenting, well, every time when they're presenting with hip pain, to assess whether their hip flexors are tight or whether there's a weakness there and it's kind of throwing us slightly. But for the purposes of doing a bit of a self-assessment at home, there are things you can do. So what you're going to do is sit on the edge, not so you're nearly falling off, but sit on the edge of the couch, bed, whatever it is you're using at home. You're then going to safely bring your knees up towards your chest and gently rock back. So your flat of your back should be nice and flat or pushed into the couch there. What you'll then do is just let one leg drop. So what you'll find, mine goes nice and flat down, so I've not got tightness in here. But if you are tight, you'll probably find that it actually doesn't go flat down. Well, it won't go flat down, and you'll feel a pulling sensation through there that's quite uncomfortable. If you find that you've got hip pain and your leg is going flat down, so say this side, my left side, was painful at the moment, that would actually indicate then I've got a weakness in that hip rather than a tightness in that hip. So bringing this leg back up and taking the other one down just to check they're the same. This one's a little bit tighter than this side, but it's still going flat down onto the couch there. If it is that your leg isn't going all the way down, or certainly not within a sort of a little wedge of an angle, you can then use this as a stretch for it. So it works quite nicely. You would just lay there for 45 seconds ideally, and you'll find that the weight of your leg naturally gently stretches it out, which works quite well. If it's that you've got a weakness in those hips, then we'll be looking at exercises to do to strengthen the hips or to strengthen the hip flexors, and therefore reduce that pain. What we need to look at doing, and certainly assessing, and certainly something that we assess in clinic, if there's a tightness in that muscle, we need to work at loosening that muscle if that's what's causing the pain. Now, just because there's tightness doesn't mean that muscle's actually strong. It may be tight because there's been an injury. But if it is tight, we need to loosen it before we then work out what we're doing thereafter. If it's that it's loose and that it's painful, so if you've tested this and the leg's going down and there's a full range of movement seemingly in that muscle, however there's still pain at the front of the hip or sort of into the hip flexor there, we need to look at potentially loosening the lower back, which I've done another video on, with some mobilisations to get this lower back moving. But equally we need to work at strengthening that loose muscle and going from there. So it's a good test to do to see why you might be getting that hip pain in the absence of a therapist being able to do it for you. And then it's a good stretch to continue doing if you find that your hips are tight. If you find that your hips are actually, they've got a good range of movement seemingly, then you need to look at doing some strengthening exercises, and that's certainly something that a therapist can prescribe for you.